Upper extremity muscles. Anterior deltoid origin, lateral third of clavicle. Insertion, deltoid tuberosity of humerus. Three actions include flexion of humerus, horizontal adduction of humerus, as well as medial rotation of humerus. Middle deltoid origin, lateral acromion. Insertion, deltoid tuberosity of humerus. Action, abduction of humerus to 90 degrees. Posterior deltoid origin, spine of scapula. Insertion, deltoid tuberosity of humerus. Three actions include extension, horizontal abduction, and lateral rotation of humerus. Coracobrachialis origin, coracoid process of the scapula. Insertion, medial humeral shaft. Two actions include flexion of humerus and adduction of humerus. Latissimus dorsi. Four origins include thoracolumbar aponeurosis, sacrum, iliac crest of ilium, as well as the inferior angle of scapula. Insertion, bicipital groove of humerus. Three actions include extension of humerus, internal rotation of humerus, and adduction of humerus. Teres major origin, inferior angle of scapula. Insertion, bicipital groove of humerus. Three actions include extension of humerus, internal rotation of humerus, as well as adduction of humerus. Infraspinatus origin, infraspinatus fossa of scapula. Insertion, greater tubercle of humerus. Two actions include lateral rotation of humerus and extension of humerus. Teres minor origin, axillary border of scapula. Insertion, greater tubercle of humerus. Two actions include lateral rotation of humerus and extension of humerus. Triceps brachii origins, long head, infraglenoid tubercle of scapula. Medial and lateral head, posterior humerus. Insertion, olecranon process of the ulna. Two actions, long head, extension of humerus, also extension of elbow. Trapezius upper origin, external occipital protuberance. Insertion, upper, lateral third of clavicle, also acromion of scapula. Two actions include elevation and upward rotation of the scapula. Trapezius middle origin, C7 to T3 spinous process. Insertion, middle, spine of scapula. Action, adduction or retraction of the scapula. Trapezius lower origin, T4 to T12 spinous process. Insertion, lower, root of spine of scapula. Two actions include depression and upward rotation of scapula. Supraspinatus origin, supraspinatus fossa of scapula. Insertion, greater tubercle of humerus. Two actions include abduction of humerus as well as stabilization of head of humerus. Pectoralis major origins, medial half of clavicle, clavicular head, and sternum and cartilages of upper six ribs, sternocostal head. Insertion, bicipital groove of humerus. Five actions include adduction, both heads, horizontal adduction, both heads, medial rotation of humerus, both heads, flexion of humerus, clavicular head only, and extension of humerus from fixed position, sternocostal head. Pectoralis minor origin, anterior surface of ribs 3, 4, and 5. Insertion, coracoid process of scapula. Three actions include abduction or protraction, depression and downward rotation. Biceps brachii origins, short head, coracoid process of scapula, and long head, supraglenoid tubercle of scapula. Insertion, tuberosity of radius. Three actions include flexion of elbow, supination of forearm, as well as flexion of humerus. Levator scapula, origin, C1 to 4 transverse processes, insertion, vertebral border of scapula. 2 actions include elevation and downward rotation of scapula. Rhomboids, minor and major, origin, C7, T5 spinous process. Insertions include root of the spine of scapula and the vertebral border of scapula. 2 actions include adduction or retraction, as well as downward rotation of scapula. Subscapularis, origin, subscapular fossa of scapula. Insertion, lesser tubercle of humerus. 2 actions include medial rotation of humerus and adduction of humerus. Serratus anterior, origin, lateral surface of upper 8 ribs. Insertion, vertebral border of scapula, anterior surface. 3 actions include abduction or protraction, as well as upward rotation of scapula, and serratus anterior also stabilizes the scapula against chest wall. Brachialis, origin, anterior shaft of humerus. Insertion, tuberosity of ulna. Action, flexion of the elbow. Brachioradialis, origin, lateral supracondylar ridge of humerus. Insertion, styloid process of radius. Action, flexion of elbow, with forearm in mid-position. Extensor carpi radialis longus, origin, lateral epicondyle of humerus. Insertion, base of second metacarpal. Actions include extension, as well as abduction of wrist or radial deviation. Extensor carpi radialis brevis, origin, lateral epicondyle of humerus. Insertion, base of third metacarpal. Action, extension of the wrist. Extensor carpi ulnaris, origin, lateral epicondyle of humerus. Insertion, base of the fifth metacarpal. Actions include adduction of the wrist, or ulnar deviation, as well as extension of the wrist. Extensor digitorum, origin, lateral epicondyle of humerus, common extensor tendon. Insertion, extensor expansion of forefingers. 2 actions include extension of forefingers at MP joints, and it assists in extension of the wrist. Supinator. 2 origins include the lateral epicondyle of humerus and the proximal posterior ulna. Insertion, lateral surface of proximal radius. Action, supination of the forearm. Abductor pollicis longus, origin, posterior radius. Insertion, base of first metacarpal or thumb. 2 actions include abduction of the thumb at CM joint, and it also assists in wrist abduction. Extensor pollicis brevis, origin, posterior radius. Insertion, base of proximal phalanx of thumb. 2 actions include extension of thumb at MP joint, and it also assists in wrist abduction. Extensor pollex longus, origin, posterior ulna. Insertion, base of distal phalanx of thumb. 2 actions include extension of thumb at IP joint, and it also assists in wrist abduction. Pronator teres. 2 origins include the medial epicondyle of humerus as well as the coronoid process of ulna. Insertion, lateral shaft of radius. 2 actions include pronation of forearm, and it also assists in flexion of elbow. Pronator quadratus, origin, distal fourth of anterior ulna. Insertion, distal fourth of anterior radius. Action, pronates the forearm. Flexor carpi radialis, origin, medial epicondyle of humerus. Insertion, bases of second and third metacarpals. 2 actions include flexion, as well as abduction of the wrist, or radial deviation. Palmaris longus, origin, medial epicondyle of humerus. Insertions, palmar aponeurosis and flexor retinaculum. Action, assists in wrist flexion. Flexor carpi ulnaris, origin, medial epicondyle of humerus. Insertion points, pisiform, hamate, and the base of fifth metacarpal. Two actions include flexion, as well as adduction of the wrist, or ulnar deviation. Flexor digitorum superficialis, origin, medial epicondyle of humerus. Insertion, sides of shafts of middle phalanges of four fingers. Two actions include flexion of four fingers at PIP joints, and it also assists in wrist flexion. Flexor digitorum profundus, origin, proximal anterior ulna. Insertion, bases of distal phalanges of four fingers. Two actions include flexion of four fingers at DIP joints, and it also assists in flexion of wrist. Flexor pollicis longus, origin, middle of anterior radius. Insertion, distal phalanx of thumb. Action, flexion of thumb at IP joint. Dorsal interossei, origin, adjacent dorsal surfaces of metacarpals. Insertion, extensor expansion of the second, third, and fourth fingers. Actions include abduction of the 2, 3, and 4 MP joints, and it also assists in lumbricals. Palmar interossei, origin, shaft of second, fourth, and fifth metacarpals on the palmar surface. Insertion, extensor expansion. Actions include adduction of 2, 4, 5 MP joints, and it also assists in lumbricals. Lumbricals, origin, flexor digitorium profundus tendons. Insertion, extensor expansion. Two actions include flexion of four fingers at MP joints, as well as extension of four fingers at PIP and DIP joints. Anconius, origin, lateral epicondyle of humerus. Insertion, olecranon process. Action, assists extension of elbow.